Hello and welcome back. My name is Jack B. And as always, thank you for taking time to view my video. I was researching the prevalence of COVID in America today. And if you believe the information put out by our federal government through the CDC, then only one state, Arizona, shows increases in COVID infections. 10 states are not changing. 4 states are likely declining. 3 states are not estimated. And 31 states reflect declining rates of infection. I'm not sure I can buy into this data because of RFK Jr. and his associated group of deniers. I then researched the global cumulative effects of COVID. The results are surprising, but I suspect that people will say the data is wrong and the other countries lied about their data. KFF is an independent source for health policy research, polling, and news. They maintain a global COVID-19 tracker. The latest tracker was published October 29, 2025. There was an editorial note attached to the publication that read, "This tracker will no longer be updated because the data source has ceased tracking government responses to COVID-19. For more information, please visit the Oxford COVID-19 Government Response Tracker." The following data is current up to the date of October 12, 2025. The KFF Overview Report states the global cumulative number of COVID infections is over 778 million, and the global cumulative number of deaths due to COVID infections is over 7 million. The current number of weekly COVID infections is 36,245, and the current number of weekly new deaths is 84. I thought it would be interesting to see how the U.S. compared to other countries in the world. I compared the cumulative COVID statistics from 11 countries: the U.S., Iran, Brazil, Russia, India, UK, Turkey, Germany, France, Australia, and China. The statistics I compared were the country and its population, the total number of infections and the number of infections as a percentage of the population, the total number of deaths, the number of deaths as a percentage of infections, and the percentage of deaths as a percentage of the population. The results are interesting. The one statistic that reflects the percentage of deaths per the number of infections tells a story of care provided. I won't recite all the statistics from each country because it may be too mind-numbing, but I do have a summary of the data that I will cover. The U.S. has a population of approximately 342 million people, which makes it the third most populated country in the comparison table. The U.S. has a cumulative total of over 103 million infections, which makes it number 1 for infections, a cumulative total of approximately 1.2 million deaths, which makes it number 1 for deaths. The U.S. percentage of deaths per its population is 0.36%, which makes it number 1 in this category also. The U.S. percentage of infected people compared to the population is 30.24%, which makes it number 5. The U.S. percentage of deaths of infected people is 1.19%, which makes it number 4 on the list. The population of India is over 1.46 billion people, which is 4.3 times larger than the U.S. The U.S. had over 58.3 million more infections and 694,442 more deaths than India. The population of China is over 1.41 billion people, which is 4.1 times larger than the U.S. The U.S. has more than 4.05 million infections and more than 1.1 million deaths than China. It was surprising to see that India, UK, Turkey, Germany, France, Australia, and China have better survival rates of the infected than the U.S., although the survival rate in the U.S. was better than Iran, Brazil, and Russia. At this point, I hope the United States is better prepared for a future virus outbreak than it was before the COVID-19 pandemic. I suspect it is not as prepared as it ought to be. The information available from my research indicates significant progress has been made in certain areas, but challenges remain. The top challenges are inconsistent data collection and analysis, funding, and coordination gaps. Areas where the U.S. has made progress and improvements are: number 1, enhanced surveillance. The U.S. has improved its data collection, genomic sequencing, and wastewater surveillance capabilities to detect and track new variants and emerging threats more effectively. Number 2, medical countermeasures. There is now a more established domestic vaccine manufacturing capacity, and the U.S. government is committed to the development of new medical countermeasures, vaccines, drugs, and diagnostics. Although I'm not convinced this one is true. Number 3, stockpiles and logistics. The Strategic National Stockpile, SNS, has been stocked with essential supplies such as masks, ventilators, and at-home tests for the general population. A permanent logistics and operational hub has also been established at the Department of Health and Human Services, HHS, to ensure rapid development and delivery of tools. Number 4, frameworks and plans. Agencies like the CDC have implemented a public health response readiness framework. They conduct operational readiness reviews to improve response outcomes. The HHS has also developed a national pandemic strategy that leverages capabilities developed for influenza preparedness to address other emerging diseases. I am not sure how this one can be implemented with all the financial and personnel cutbacks. Number 5, global collaboration. The U.S. recognizes that infections originating anywhere in the world can quickly reach American cities. Most of the actions of this administration indicate they don't play well with others. There still are continuing improvements to be made, such as, number 1, funding volatility. Public health funding often follows a feast or famine cycle, which increases during the crisis and then decreases after the crisis, which makes it difficult to sustain long-term studies, programs, and a public health workforce at state and local levels. Number 2, coordination and leadership. There is a lack of a single strong focal point at the federal level that is responsible for ensuring pandemic readiness and coordinating an effective, coherent, nationwide response. This will lead to a lack of clarity and confusion over federal and state responsibilities. Number 3, public trust and misinformation. Misinformation and a lack of public trust in leadership and health authorities remain serious problems that can undermine the effectiveness of public health measures such as masking and vaccination. Number 4, supply chain weaknesses. There still is overdependence on single nations for critical medical supplies, which causes a risk. Diversification is necessary. Number 5, health disparities and distribution of required medicine and supplies to marginalized communities is still an issue. Strategies and logistics to increase the supply and distribution chain need attention and investment. In summary, while lessons from COVID-19 have led to some concrete improvements, it appears that ongoing, sustained investment and continued political support are crucial to fully prepare the nation for the inevitability of future outbreaks. There are too many disruptions and distractions in America today. The politicians on both sides of the aisle are at fault, and the news and social media outlets are also at fault, leading viewers down the rabbit hole following the politicians. It would be great to see someone or some group that could look past the smoke and mirrors to bring the important issues to the forefront. But unfortunately, the only thing that is important to corporations and politicians is more money and bigger profits. Americans' health, safety, and welfare take a back seat. Well, these are my thoughts for today, and again, whether you agree or not, please verify the information presented. Thank you, and until next time, take care and be safe. Ooh.